Hello everyone, I'm Dr. Peggy Mulongo and I'm bringing my contribution to this conference by discussing aspects of acculturation which could enhance the mental health of young refugees who were settled in Greater Manchester under the Global Humanitarian Program. This program is known in the UK as the Gateway Protection Program. I conducted this research, part of my PhD, and to understand the rationale for this, let me give you a brief introduction of my background. I am a lecturer in mental health nursing and practice at UCLan and a registered mental health nurse with an expertise in cross-cultural mental health. Throughout my career, I mainly worked with refugees and asylum seeker families, and having worked for many years part of the Gateway Protection Program, this raised my interest in conducting this study. Over the years, I contributed to develop several community-based participatory research, CBPR, and one of the most successful projects I developed and implemented in 2011 is the SOS project, the FGM Therapeutic Clinics, award winner of the British Journal of Midwifery in 2014. So, what is the Gateway Protection Program? The United Kingdom is one of the developed countries in the world who is in agreement with the UNHCR, known as United Nations High Commissioner for Refugees, to resettle refugee families coming from a country of refuge. And the Gateway Protection Program is the very first resettlement scheme introduced in the UK in 2004. So we have four different schemes in total, but the gateway is the very first one. Their journey will start from their country of origin to a second country where they will seek asylum and they will be living in refugee camps before being offered a permanent residence in a third country known as the resettlement country. And in this case, the UK is the resettlement country, the host country. Over the years, the Gateway Protection Program has been promoted as a successful model of integration. However, how much the general public knows about this program, who are gateway refugees, how they may be different from asylum seekers or to other refugee populations, for example. What about their children and young people? What are their acculturation experiences post resettlement and how this may affect their mental health? So many questions with nearly no answers, as this particular group is mainly unknown to the wider community. Looking at this closely, during my literature review, there was limited global evidence on the impact of acculturation on the mental health of young refugees who resettle in third countries in general. And this particular field remained unexplored in the UK, making this study an innovative one. Also, because of the current global refugee crisis, the United Nations put pressure on third countries uh, um, including the UK, to increase their quota on resettlement programs. So they should have more, they should accept more refugees coming under these particular programs. And there is therefore a gap in research, which raised my research interest because the UK mental health policy recognizes that children and young people are a priority group for mental health promotion and prevention. However, as a resettlement host country, there is a huge lack of documented evidence around the impact of acculturation on the mental health of young refugees resettling in the UK under the Gateway Protection Program. This is a qualitative study that aims to explore aspects of acculturation that could contribute to enhance the mental health of young refugees resettling under the Gateway Protection Program in Greater Manchester. This study was guided by two main questions. How does acculturation impact on the mental health of GPP young refugees? And also, what are positive elements of acculturation that are likely to improve their mental health? Subjectivism was the ontological stance used in the study, as it considers as primary reality people's thoughts and opinions. This relates very well with interpretivism, which is my chosen epistemology, as it considers multiple truths, recognizing that each young person would have their own interpretation of what truth is when narrating their stories. Interpretivism will therefore help construct meanings within various social contexts, and it is mainly used in qualitative methodology. This is a visual art-based narrative qualitative research, and I chose to use this because I found that it would give participants the opportunity to express their feelings. I also thought it will be effective in limiting any bias coming from me as a researcher, and it is proven effective when engaging with non-Western cultures, especially with refugees. Furthermore, it is suitable with my personal and professional experiences of using art as a therapeutic and research tools for several years. I think visual art-based narrative research gives participants a voice to communicate freely, and I was happy to find out that it was also used in some of the studies included in my literature review. In regard with ethical dilemmas, I needed to distance myself from my preconceived ideas related to my personal and professional backgrounds, which may well have an influence on how I engage in this research process. I also made necessary arrangements to deal with any emotional distress occurring during data collection. Finally, reflexivity became an ongoing activity throughout this study as I constantly reviewed my personal thoughts and position in this study to avoid any form of control or influence over participants. My population ensemble included 31 young refugees relocated under the Gateway Protection Program in Greater Manchester, and they took part in 4 focus group discussions. Inclusion criteria included English speakers, males and females, aged between 16 and 25, and they needed to spend at least 3 years in secondary school here in England, and then they should have lived in Greater Manchester. This is a multi-method design. I combine focus group discussion and visual art-based activities, part of a two-stage process. Stage one of the multi-method consisted of 3 main visual arts-based activities and an informal group discussion, map exercise, timeline, self-portrait. And then stage two consisted of a 1 main visual art-based activity and an informal group discussion. Participants could choose between painting, drawing, collage, creative, writing, etc., and then create a piece of art to express their emotional feelings, and they had to provide a written explanation of their artworks. All artworks in the 2 stages have been photographed. And then data that were collected via focus group discussions were transcribed and included for analysis. We've used thematic analysis to collect data. These are examples of visual art-based activities used in stage one. We have an example of a timeline, a map activity, and a self-portrait. And these are examples of artwork produced during stage two. Um, these have been produced by 2 different participants. 4 key themes emerge from data collected, each having some sub-themes as shown in the following 4 slides. Theme 1 is called People and Places. Theme 2, It's Nearly All New to Me. Theme 3, Finding Self. Theme 4, With Me in Mind. Themes and sub-themes were discussed in depth in the study, resulting to the following main findings. All participants, they were from 5 different ethnic groups, they all reported having experienced a high level of distress during the early stage of resettlement. Most participants expressed a gradual decrease of emotional distress several years after their resettlement. I would like to highlight that the average in terms of stay in the UK was in between 4 years and 11 years resettlement. However, 10 participants still reported continuous feelings of anger and rejection, even several years after they've been resettled here in the UK. All participants acknowledged the positive impact of same and cross-ethnic peer relationships. They recognized that it was contributing to increase their happiness and self-confidence. So having friends, peer relationship between people from the same culture, young people from the same culture or cross-ethnic was a contributing factor to enhance their happiness and self-confidence. The value of family support was also acknowledged. However, many participants indicated that parental influence contributed to intergenerational conflict and then sometimes compromising their happiness. Resilience was a response to, as a coping strategy, it was used as a coping strategy to the various struggles they encountered during their resettlement journey. And then the development of resilience was identified by all as a notable way of coping with their past, current, and future mental well-being. As mental health nurses, we are frontline workers, and we should highly promote a person-centered approach when caring for gateway young refugees. Their social-cultural and emotional needs should be considered, and mental health nurses also need to ensure that they are aware of gateway young refugees pre and post resettlement experiences. These often include trauma and other mental health problems, and then they need to also be aware of their cultural values and norms, which are important. Mental health nurses need to ensure that they are culturally competent when addressing the mental health needs of this particular group because it is often fluctuating during their acculturation journey in the UK. If you have any question, please contact me. Details are included here. The International Journal of Mental Health Nursing has recently published an academic paper relating to this study, in case you want to find out more about this research. So thank you very much for listening to this presentation.